I've had a request to do a video about disability and stroke. Almost every day that I do disability exams, I see at least one person who suffered a stroke, and they're often among the most disabled people I see. So here goes. Now, the thing is, stroke is an extremely complex topic, and you really could spend hours or even days studying it. So I'm going to try to make this simple, and I'm going to talk about what a stroke is, how a stroke can make one disabled, and then a little bit about prevention of strokes, because a stroke is always a sad event, and I've seen way too many people having an acute stroke when I did emergency medicine, and then way too many people disabled by a stroke doing Social Security disability exams, and a lot of those strokes could have been prevented. Hello, I'm John Foster. I'm a medical doctor who does Social Security disability exams, and as usual, everything I say reflects my own opinions based on my own experience and study, and not the opinions of the Social Security Administration or any other medical body. Now, a stroke is sudden death of part of the brain caused by lack of circulation. The part of the brain stops getting blood flow, and there are two main causes. The most common cause is a blood clot plugs one of the blood vessels that supplies blood to the brain, and that's the case in 85% of strokes. The other common cause is one of the blood vessels going to the brain ruptures and bleeds into the brain, and that's responsible for about 15% of strokes. There are other causes, but they're quite rare, and I'm not going to go into them now. Now, when a stroke happens, it happens suddenly. The person goes from being normal to having major symptoms in seconds to minutes. What happens is there is a part of the brain that loses all circulation, and that part dies. Then surrounding that area is a part of the brain that gets poor circulation, but still gets a little. And some or even all of that part of the brain can recover, usually slowly over days, weeks, or months. One of the most notable features of strokes is they are so variable. The amount of damage to the brain can range from tiny and insignificant to huge and catastrophic. Likewise, the amount of recovery from a stroke can range from complete, which is quite rare but does happen, to none at all, which again is quite rare but does happen. In most strokes, the damage occurs within minutes, and then most of the recovery occurs in the first few days. Some occurs in the first few weeks. Less occurs in the first few months. But I have seen people who continue to improve up to and after a year after the stroke. And this brings me to the first important item for disability, which is to apply for Social Security disability from a stroke. It must be at least 3 months after the occurrence of a stroke. Social Security will not approve a claim if it's less than 3 months. However, if you are more than 3 months from your stroke, you might as well apply now. There is no point in waiting. So how to prevent a stroke if you've never had one, and also important, how to prevent a second stroke if you have had one, because if you've had one stroke, you're at high risk for having another. Well, the major preventable risk is high blood pressure. And this really is sad for me because 1/2 of Americans with high blood pressure haven't been diagnosed and prescribed high blood pressure medicine. And of the 1/2 who have been prescribed high blood pressure medicine, 1/2 don't take their medicine regularly. And it's such a tragedy to see somebody who's crippled by a stroke that could have been prevented if they just took 1 or 2 high blood pressure pills every day. To prevent a stroke, you must take high blood pressure pills every day, not just when you feel like it. Other risk factors for a stroke that can be treated are cigarette smoking, use of stimulant drugs like cocaine, meth, and Adderall, diabetes, and alcoholism, especially binge drinking, where the person is sober for a while and then drinks extremely heavily for a while. Also, there is a heart condition called atrial fibrillation that puts a person at high risk for a stroke. And that risk can be reduced a lot by taking anticoagulant medication, what is commonly called blood thinners. If you have stroke symptoms, which are usually weakness on one side of the body, numbness on one side of the body, or difficulty speaking, you should go to the hospital immediately by ambulance. When you work in the emergency room, you learn that a lot of people come in by ambulance who didn't need it. For example, I've seen people come in for toothaches by ambulance, and a lot of people who should have come in by ambulance come in by private car, such as people who are having heart attacks or who've been shot. If you think you're having a stroke, please call the ambulance and go directly to the hospital. The reason is there is treatment that can help significantly for a lot of stroke patients, but that treatment has to be given as soon as possible. The sooner you get the treatment, the better you're likely to be. One problem is that it's fairly common for strokes to occur while asleep, and the person wakes up with the stroke and doesn't know when it occurred. One more thing you need to know before I go into the disability is that your brain crosses over. The left side of the brain controls the right side of the body. So, for example, the left side of my brain controls the right side of my face, my right arm and hand, and my right leg. Likewise, the right side of the brain controls the left side of the body. Also, if you are right-handed, usually the left side of the brain controls your ability to speak. So a stroke that affects the left side of the brain in a right-handed person can affect the ability to speak. In left-handed people, it's more complicated, and I won't go into that. Now, strokes can affect a lot of work-related abilities, and therefore many people who've had strokes are likely to be approved for Social Security disability. And here I'm going to go through the common disabilities. The first is related to the eyesight, and this is what we call a homonymous hemianopsia, which means the person loses the ability to see on one side. For example, I may be able to see fine on my left, but lose my peripheral vision on the right. And sometimes people who've had strokes don't even notice this, so it's important to check for. I've already mentioned that there can be loss of speech, and this can be anything from mild difficulty to speaking to complete inability to speak. And I've seen 2 people for Social Security who totally lost their ability to speak. And sadly, most people who lose the ability to speak as the result of a stroke also lose the ability to write. The next thing is loss of use of the limbs. And in the most common type of stroke, this affects the arm more than the leg. So often one arm will be completely paralyzed and one leg will be weak but still able to move. Also, in some strokes, there may be normal strength in an arm or leg, but there may be loss of control, so that, for example, the patient can squeeze tightly, but when it comes to manipulation, like buttoning a shirt or writing, their hand is very clumsy and they can't do fine manipulation. The next thing is that there may or may not be loss of sensation. The arm or leg or face that are weak may also be numb. There may be trouble standing up from a seated position, and there may be trouble getting up from a lying down position, and Social Security considers those important limitations. There may be trouble with balance, and again, that's an important limitation because Social Security wants to know if the person can work at heights, on ladders, scaffolds, or near dangerous machinery. And if the person has loss of balance and is at risk for falling, they can't do any of those things safely. Finally, there can be interference with the ability to think and remember, although serious interference with the ability to think and remember is fairly rare in stroke. Social Security wants to know if the person has any difficulty with understanding, remembering, reasoning, applying information, interacting with others, concentrating, persisting, maintaining the pace of a job, adapting to new circumstances, and managing oneself. One of the issues that almost always accompanies a stroke and can be disabling is depression. It's normal to be depressed after a stroke, and sometimes that depression can be very serious. Few people are depressed as a person who's totally lost the ability to speak, because all of a sudden they're completely cut off from communicating with the rest of humanity. And if you have serious depression, you should include that in your disability application. If you've been watching so far and you find this information useful, you may want to subscribe to this channel. And also, I'm looking for ideas for further videos, other topics such as stroke. The only thing is, they have to be conditions that I see fairly frequently in disability exams. I can't do a video on something that I've only seen once or twice in the past few years. Now, what to do to prevent a second stroke if you've already had a stroke? Well, there are several possibilities. Often a stroke is due to hardening of the arteries in the neck, called the carotid arteries, that bring the blood flow to the brain. And if that's the case, sometimes surgery on those arteries can improve the circulation to the brain. Keeping blood flow normal is a big step towards preventing another stroke. Ideally, the blood pressure should be at 120/80 or lower, but most of the risk is eliminated if it's at 140/90 and lower. And in the description to this video below, I'll include a link to a good blood pressure machine you can use to take your blood pressure at home. If your blood pressure is over 180/110, it is severely high, and you are at high risk for a stroke, and I strongly urge you to see a doctor and get on high blood pressure medication. Also, stopping smoking, treating diabetes to get blood sugar towards the normal range, not drinking heavily or using stimulant drugs such as meth or cocaine, and taking blood thinners if you have atrial fibrillation will all reduce your risk of a second stroke. Finally, when it comes to a disability application, 3 things may be helpful. The first is an MRI scan of the brain. Now, I know I've talked a lot in other conditions about how MRI scans are not that helpful, but they are very helpful for showing strokes. And if you have one, I would definitely send that in to Social Security. The next would be a consultation with a specialist called a neurologist. A neurologist is a specialist in diseases of the brain and nerves, and one of the most frequent conditions neurologists treat is strokes, and the opinion of a neurologist will help your disability application. The final thing is, if you're having significant problems with your thinking or memory or mood, a psychological evaluation can help your disability application. If you can get one privately, that would help. If not, I would request one from Social Security. Well, I hope this has been helpful, and as always, remember, if it happens, it's possible.